Hi, everybody, and welcome to our webinar today on sharing some tips that we have learned when it comes to healthy and safe events and managing the attendee experience as we get back to live events. I am Sarah Haynes, and I am the Vice President of Event Management at ITA Group. And I have been with ITA for the past 14 years, really focused on live events, execution, working with our clients to help them solve all of their logistics needs and help them meet their meeting objectives. And the past 12 months really we've shifted our focus from live events to supporting clients with various alternative solutions, such as alternative awards and virtual events and hybrid events. And I'm joined here today by Erica White, and I'll let her introduce herself.
Hi, everyone. Erica White, Event Solutions Director at ITA Group. Excited to be here. After 14 years in operations here, I have moved to the pre-sale side, supporting sales and group event management, as well as onboarding our new clients here at ITA. Most recent, though, I've become a COVID testing specialist, so that's kind of my new thing.
So the past 12 months have clearly brought a whole new set of challenges to all of us. And so that's what we wanted to do today, is really share with you what we've been focused on over the last 12 months. What are some of the new contracting guidelines that we've been looking at, the new health and safety protocols, both in the planning stage and on site, what that attendee experience looks like, and how you manage that attendee experience to make sure you're not negatively impacting the attendee when they're on site. And so we're going to share with you some different tips that we've learned along the way, because a lot of things you put the perfect plan in place, but once you operationalize it, things shift. And now that we have gotten back to operating some live events, we definitely have some lessons we are excited to share with you. So I'll turn it over to Erica.
All right. I think the one thing that's very clear that we've all heard and felt is that everything has changed, right? So from the minute we all started working from home, we had to start canceling our events. We were going virtual. We were learning new technology, learning about capabilities and platforms we had never heard of, and it was all happening really fast, right? So as far as needing to change the architecture of our events once they went to that virtual world, again, the technology, terms and conditions in contracting and sourcing has changed greatly. But the one thing I think that has been most impacted overall is us as people, right? The attendees.
Yes, the attendees is the whole reason we come together, is to bring people together to teach them something, allow them to network and engage with them and help them engage with your brand. And that's a huge piece in building the confidence and comfort of the attendee group to make sure that they're ready to travel. So now you have to start asking yourself questions. What are the demographics of your group? Have they traveled over the last 12 months? Are they nervous to travel? How do they feel? What's the sentiment within the population that will attend your event? And is your event engaging enough to make them want to come to it in person? So those are things that you really have to start asking yourself and balancing as you get back to operating live events, along with the risk versus the reward.
Absolutely, Sarah. Risk reward. We have been doing as planners on-site risk mitigation plans forever, right? We have always made sure we had a backup plan for when the transportation breaks down halfway between the hotel and the airport, when the boat stumbles out and the motor dies in the middle of the ocean, right? We've always had risk. So this isn't new. What's new is that our attendees are acutely aware to the risk associated with COVID-19, right? And this pandemic. So we have to be more forward with it, more transparent, where before we kind of just kept it behind the scenes. We had the plan, but we didn't have to really talk about it. So it's so important to make sure that if you are holding that live event, that risk is absolutely worth the event that you're putting into place. So you need to put the time and resources into making sure the event is impactful, it's meeting those objectives, and that your attendees feel safe. And with that naturally comes that in-person draw, right? I think it's been a cycle. I don't know, Sarah, if you can attest to this, but I feel like there is this world where everyone was so excited or getting comfortable with that working from home and that remote. And though there are people that really are, there are people that are dying to get back out and network in person.
Yeah, and I think we're seeing that the confidence in starting to travel again through the leisure area. I mean, at ITA Group, we do have a leisure travel division, and I mean, that's the area that it's busier than ever because people are starting to want to explore getting out on the road again. And, you know, I think once that happens, that's when all the live events will start to come back in more force.
Absolutely.
So some of the things we also want to talk about, you know, the different changes and new considerations that you have to think about. You know, there's always been things you need to consider when you are picking a destination or a property, whether it be, you know, what's the location, what's the environment there, you know, from a health or a safety measures, you know, is it someplace that has good infrastructure, you know, good hospitals, all of that. But now it's this whole new element of government regulations, CDC guidelines, and it's different across the country and across the world. So you need to understand when you're picking your destination, what are those requirements within the destination, but also from where your people are coming from. You know, today, you know, there's still some quarantine measures in place, even going state to state. Testing might be required for entry, you know, back into the U.S. from an international destination. Those are all things you need to consider and continuously monitor because they do change daily. So you need to make sure that it's not just at the time of contract, but that you're consistently checking in to see if you need to update your procedures. In addition, you know, and Erica can jump in here on this, it's, you know, what's the hotel doing? What are the venues that you're selecting doing? And do you feel it's enough? Would you want to do additional? And Erica, I don't know if you want to address maybe some examples of what you've seen some properties doing or clients do.
Absolutely. You know, I think the first step is always talking to the hotel or the venue and finding out what they have, you know, what's the starting point, right? And then also going back to you as a company, what policies, what expectations have you guys put into place so that your employees feel safe traveling? You know, there's other vendors to take into consideration. You know, the attendees are number one, but what about the people working behind the scenes to help make all of this happen for you? What are their companies doing? You know, your transportation company, like the drivers, those sorts of things. There's so many different vendors we need to take into consideration and understand their plans, their expectations before we roll out, you know, our plan and our recommendation. I think one thing, you know, and Sarah, you hit on it, it's the constant change and evolution of this. You know, initially it was the cleanliness, like how are we wiping down everything, always, you know, someone touched something, someone's wiping it down. And though that's still really important, we've seen a big switch as we've learned more, right, that it's airborne is a big factor. And so, not that we ever didn't, but so now it's not so much the cleanliness, it's also bringing in those HEPA filters and making sure we're in open air venues when possible for good air circulation, ensuring that we're, again, mitigating risk in every possible place that we possibly can.
True. And that, you know, that really comes down to it's being flexible on that and making sure that you're understanding what those new procedures are and what we need to be addressing. And that really goes into how we came up with our phased approach to operating events again. And it starts with prevent. And some of the things that Erica just talked about are, what are some of those measures you can put in place to make sure you're building confidence for the attendee and that you're detecting, you know, where your risks lie ahead of time, and then detecting, and this is a new element for a lot of us, and this is where it's, you know, testing, providing COVID testing on site or even prior to travel. And this is, you know, where ITA Group reached out and created a partnership with Eurofins, which is a testing provider, and they are supplying the COVID tests for us that we are able to offer our clients. And we'll get into some of those different solutions in a minute, because it's a new thing for a lot of people, and it's something though that really can help build confidence in your attendees. And then the respond, you know, if there is a positive test, how are you responding to that? Or if somebody does come down with symptoms on site, What are you doing to address that? And how are you aligned with all of your partners? So this goes into, you have the 3 phases. If you look at how do you instill that confidence, it comes down to communication. Erica touched on it before, but communicating to your attendees what those expectations are going to be on site. Communicate, before registration even opens, to let them know you're going to have this event, you're planning to move forward. Here are the things that you're putting in place today to build confidence, so when the registration site opens, they feel like you have a good plan in place. And then communicate throughout the registration process and make sure that you're letting them know that it's going to be flexible and will continue to change and evolve as new information comes out. So it's not just a one-time communication. I mean, we always say you need to over-communicate in events because people read half of the information, but this is stuff that they truly are reading and care about. And then make sure you have a two-way form of communication so they can come back and ask questions and that you're able to address all of their concerns, again, to continue to build that comfort and confidence in traveling again. Erica, I don't know, do you want to share maybe some examples of what we've done when it comes to communication plans that might be unique?
Yeah, absolutely. I think, starting with, a lot of people have been doing this, right? Surveying your attendees and finding out their comfort levels from before even deciding what direction you're going to go with an event, whether that's hybrid or live. Surveying them and addressing any of those concerns. And then you develop your communication around what you hear. The more you feel heard, the more likely you're willing to go. And again, get them excited to go. Here's what is going to be happening, and here's the measures we're going to take to ensure you're safe. And it's not just what we're doing and what we're asking of them once they get there. It's also, if someone tests, or if you test positive, right? If you test positive, here's what you can expect today. If someone else tests positive, here's how we're going to communicate with you. And just, again, making everyone feel comfortable so when they get on site and heaven forbid someone does test positive, everyone is completely in the know of what's going to happen. Obviously, HIPAA is really an important element in all of this. We don't need to talk about it. We all know what it is, but it's ensuring also that all of your plans is taking in everybody's personal protections as well.
Great. And, Erica kind of teed this up, but it's having that plan. So we've all been familiar with having, emergency response plan in place or just an overall risk mitigation plan for live events. But this brings a whole new element of the health risk mitigation plan. So we've addressed some of that stuff already, from what's the air filtration, what's the airflow, how are you going to manage if someone does test positive. But having all of these plans in place before you go on site and making sure that all of your partners are aligned in that plan is critical in this situation. And that's where we really encourage. I mean, Erica, and you might want to talk from a site inspection. What are some of the things that you are recommending and working with clients to start looking at when they're walking through a property?
Oh my gosh, everything completely beginning to end, right? Walking through the flow of space, ensuring that there is enough, optional setups. We're seeing a lot of setups where we're doing a mix of, rounds with 3 chairs at it, or, a cocktail table with 1 person only, so that everyone feels comfortable and has some people are comfortable sitting around a round with 3 people, where some are like, I need to, I want to be in my own space. So talking through every different option of setups. Again, flow, is there anything else going on in that hotel? One thing that a lot of people aren't thinking about is just flow of elevator, right? Movement of elevators and people getting to their guest rooms, if that's applicable. Or, when are your breaks? Is there another group, or is there something going on where people are just staying at the hotel and a bus is going to be showing up? Want to make sure that you're thinking about everything outside of just your group as well. What precautions are the hotels taking? Are the bars set up okay? How are we going to handle the food? I mean, again, it's just things we've always been doing. We just now have to be more aware of the perception. And again, the space, the social distancing. We Sarah, you hit on it, and I just wanted to go back to that is, again, we're building out these plans to ensure they're safe, and that the on-site execution is key. You have to have those, the staff there to ensure that everyone is doing what they said and what we promised to those attendees, because we can tell them we're doing everything, but if they get there and they don't feel like we're executing on that, that never ends well. So it's really important to make sure you have, that third party. That's where we really have people have said, thank you so much. It's hard for you when you have those relationships with their internal attendees, for example, you'll say, hey, remember, put your mask on, or hey, you have to go through that thermal check, that temperature scanning, and take that daily survey before you can go in there. And just having that third party there to remind them and keep everybody, again, according to plan, as I'd like to say.
Well, and that's the key thing. I mean, these are new things to an attendee who a lot of times it's just new, so they forget to it. So it's just that gentle nudge and reminder to do things. The health screenings every day it's key in order to make sure that you're catching things that could prevent spread if there is something, if somebody does come down with, a fever or anything like that. Just having that daily reminder for them to check in with themselves is key for on-site execution. And to Erica's point too, it's, in the past, a lot of the things that we've done have been kind of behind the scenes, just things that attendees didn't even notice. And now in today's environment, you want to communicate what you're doing when it comes to how the room setups and how you're going to manage some traffic flow. You may give people time frames to come down and register for the event or check in for the event so that you're preventing everybody from coming at the same time. So those are just things you need to consider as you move forward. The other is the attendee code of conduct, where there's been terms and conditions for events for years, but the attendee code of conduct is making sure they understand all of your procedures that you're going to put in place and they agree to adhere to them prior to arriving on site. This is key. And also they understand the risk, if you're going to provide testing, what the expectation is for that. Are you requiring masks? Are you, all of those different things, you want to make sure that you're communicating all of that in your attendee code of conduct and that they're agreeing to that prior to coming on site. So that's something that is definitely a newer element that you'll want to consider. And working with a legal team is always key as well, depending on who your attendees are, if they're internal, if they're, customers or prospects. You just want to make sure that you're meeting the needs of your organization.
Yeah, and Sarah, just to jump in there, one question I get a lot is how are people handling it on site? Like, how are the attendees, reacting or responding? And I have to say, I'm so proud to say that, gracefully, like everyone is like, oh, sorry, no one's ever doing anything maliciously. I think, it's a lot of us haven't been out and about in a long time, and there's a lot to think about. And, squirrel syndrome is way more than it used to be because you're just so excited to be somewhere. So it's been great to see people and their reactions and their responses to being there. And again, the minute you're like, they know what they need to do. So it's really been a great response. So.
Yep, it's great. So the other thing, I know this is a big topic that people are very curious about typically, is understanding what the testing looks like on site and what the testing options are. So Erica, can you share a little bit of what the different options are and how people have put these into place?
Yes, absolutely. So most of you are probably familiar with one or the other or both, if not both at this point, but PCR testing as well as the rapid testing. And, you can see here on the screen some of those statistics where, initially it was a lot of the rapid on site, right? Like getting there and being able to test them right there on the spot and get immediate results, right? Once the PCR was approved, Eurofins was able to get their test approved to mail to them in advance and get those negative results prior to them even coming on site is really taken off. That's really become a popular option. Again, it's not foolproof. It's not saying they're not going to get there and that they don't have it. But what it does is it does get them as many as we can before they get on site, right? It's that comfort, again, that people are getting tested before they get there. We've seen some combinations of rapid, doing that PCR and also doing a rapid once they get on site. Those rapid tests, again, they go a little bit quicker. You need a medical professional on site with those rapid tests. So costs kind of come into play, as well as is the importance of flow, because each test can only process so many. And so we have to kind of figure out a flow and how many medical professionals we need to make that look good. So there's a little extra work that goes into those rapid tests. We can also do PCR on site as well. Those are better for the multi-day events because they don't, the results don't come back until 24 or 48 hours after receipt to lab. So we'll courier them typically to the closest lab. And again, depending on proximity to the lab, when we can quote out when those results can be expected. One thing to kind of note, it's funny how, again, things are changing constantly as we learn and have been putting on a few of these live events, is the PCR post-event. So what's happening, right, is we're hearing from people that said, like, gosh, I felt so safe. Like, right, the airlines were doing all of the right things. I felt like the hotel and you guys put on a great event. And I got home and I felt so good. And then all of a sudden I was like, oh my gosh, I just traveled. So we've started seeing more demand to have those PCR tests at home for them, actually. So when they get back, they can take that test again, and we're able to react and respond again. When we'll talk about that in a minute, but respond and say, okay, someone did end up testing positive. You were in proximity with them, like whatever that looks like, and being able to communicate to them. And it's bringing again that reassurance and that comfort to the attendees.
Yeah, that's great. And Erica, this really is how you the detect phase on site. So it's a combination of doing the testing, the health screening every day, and that can be just a quick survey that somebody does each morning. You can do the temperature checks in the morning. I think the health screenings are very common, and there's a few different ways you can do that. You can create a simple survey through whatever survey tool, but there's also different new technology providers that are also offering things like that can give you kind of a red-green light. So those are options that you can look into as well. But along with testing will help you detect to then move into responding and how you will respond if there is a positive test. So Erica kind of mentioned, you want to make sure you have a plan in place, but I thought it would be good if Erica, if you could explain kind of what are some of the things we've seen clients do when there was a positive test on site or post-event.
Absolutely. So when there's been, if they've maybe exclusively done the rapid testing, right? So if they get a positive, we're going to do a second rapid test quick and make sure we have two positives. If we get a positive and a negative rapid test, right? So, and this is where I joke, I'm like, the path of how we handle it can spiral pretty quickly. But if it also then comes to a tie, we've had a positive and a negative rapid test, that happened once, then we go to the third, and then where do we move from the quarantine? So again, this really depends on where you are and, did people drive? Did people fly? So, we had an event where people were all driving. So where they came in and got tested, we were able to, quickly just get back up to the parking lot and remove them before they had been in contact with anyone else. When they're flying, right, it's a little bit different. So the plan usually goes into the quarantine, about 10 days is that average, again, depending on where you are. If you have that, if they're then quarantined at the hotel, who's paying for it, right? And then what's our communication and how are we going to take care of them to feel safe while they're there in quarantine for 10 days? It has happened. We have absolutely had an event where we've had to unfortunately have someone quarantine for 10 days at the hotel. It wasn't great, but we made the best of it. And, they're back home and all is good. I'm trying to think. There's been a couple others where we've had to send an email post PCR, right? Someone has tested positive and we've had to go back, and luckily it's been isolated and we haven't had any issues. But again, all of the events have had a really thorough plan in place, ensuring that if something did happen, we could care for it and that everyone that was in attendance was in as safe of a situation as they could.
Yeah, and there are different solutions for contact tracing. Obviously, depending on the size of your event, if it's a small event, you know, with 20 people, it's very easy to know who they were in contact with. There are different technology solutions as well to provide contact tracing that will give you reports. Everybody wears almost like a fob, like a key fob, and that helps record who was in contact with who. So post-event, you can always get a report of who was around that person for, 15 minutes or longer, and within a certain distance of them. And you can change the settings on those. So there are different technology solutions that you can use for contact tracing depending on the need of the event. One thing though I do before we start to wrap up is address vaccines. This is a big topic that we're hearing a lot about because clients are trying to figure out, what does this look like? If part of our group has been vaccinated, do they not have to follow certain protocols? Do you call out the people that have been vaccinated, not vaccinated? And, as more and more people start to get the vaccine, we know this will continue to evolve. But Erica, I thought, do you want to share what you're hearing, what clients are doing when it relates to the vaccine today?
Yes, absolutely. Based on current status right now, we have people kind of moving forward with status quo. If they're testing everyone. They're not eliminating anyone that's been vaccinated. There's some legal, again, Sarah mentioned it earlier, talking to legal and making sure that everything that you're asking or expecting is something you can do. You can't make someone prove that they've been vaccinated, right? So there's just different, not only say loopholes, but ways to kind of go about it. But we have seen most people that are doing testing on site requiring it even for people that have been vaccinated. There's exceptions. We have one in the pipeline actually right now where they are requiring, if you attend, we're giving you an option to not attend. You don't have to attend, but you do need to be vaccinated. And we're just doing, other things on site outside of testing to ensure everyone's safety once they get there. There was rumors for a while about if once you're vaccinated, you can falsely test positive for COVID. So people were saying, well, I don't want to get tested because I'm going to be positive. And that has been debunked, which has definitely said, in the direction we're hearing from CDC is to still just keep testing everyone. Better safe than sorry kind of thing. And so that's the current direction. But as Sarah said, as quickly as things are changing and it sounds like those vaccines are rolling out a little bit quicker. And, with the new onset of this Johnson & Johnson one, that it could change in 2 weeks. So we just continue to monitor it and change our advice as we are being told we can, right? We don't set any of these, we definitely don't set any of these rules or, anything like that without any recommendation from the CDC.
Great. So all in all, we just wanted to, thank you again for attending the webinar today and just go back to over the past 12 months, things have changed. And that's where we really break it down to 3 different phases: prevent, detect, and respond. And it's making sure that you're taking all the considerations you need to take in each of those phases, but balancing that attendee experience, because you don't want it to be so much that you deter people from even wanting to go back to live events, but you want it to build confidence and without taking away from your overall objective. So we're happy to answer any questions that you might have. Feel free to ask Erica or I, and we look forward to hopefully getting back to live events soon with you. Thank you and have a great day.